Good day, ladies and gentlemen, and welcome to Economy Informant. Every week on Wednesday, an article will be discussed to inform you of the latest domestic and international economic updates, and today's video is no different. In this video, I would like to answer the question of how to respond to healthcare in Spain, especially during the pandemic called coronavirus. The topic of healthcare is time sensitive. The problem is that the government of Spain failed to react accordingly before the pandemic came knocking on the citizens' doors. What do you mean, Yeye? Well, the coronavirus can affect anyone, but experts say that the older population is more at risk. How does this affect Spain? I'm glad you asked. On the list of the top 50 countries with the largest percentage of older adults, those older than 65, Spain is ranked number 20, and this list was published on March 23, 2020. But before that, data showed that Spain was ranked number 14 way back in 2017. So my point is that the government should have been on high alert from the beginning, or at least when the coronavirus became a hot topic in mid-February. But since they failed to anticipate, guess who are the increasing victims? The older population. I have two concerns. In Spain, it is a common practice for Spaniards to greet by shaking hands in formal settings like at business meetings. However, if they know each other very well like close friends, women and men embrace or kiss each other on the cheeks. So contact is part of their culture. But what do you do when people are warned to stay away from one another because of the increase in deaths due to the coronavirus? I know there are other alternatives to speaking to your close friends, like sending a text or calling each other on the phone, but you know, and I know that that's not really the same. My second concern is that the government, from what it looks like to me, is either oblivious or negligent to the fact that the older population, especially those who live in nursing homes, are dying. The New York Times reported that soldiers were sent to disinfect nursing homes, and to their surprise, 24 people had died in that nursing home alone. The number of people dying from this virus in Europe alone is alarming, but a country where family ties are embedded so much in a culture is disheartening. I know these people are retired and need assistance to do basic tasks that teens or 20-year-olds can do in their sleep, but the issue is bigger than that. These people that the government of Spain seems to exclude from assistance were the same people that once cared for the working class today, served in the army in their lifetime, but more importantly, were faithful consumers in the economy. They helped to build the economy to what it is today. The government can at least show their appreciation by lending a hand, but no. Besides the two concerns I have, I just find the situation appalling because it is believed that Spain has the best healthcare in the world, according to a study taken last year. So what is really happening? Many believe there are three main reasons for the sudden increase in deaths due to the coronavirus. Firstly, the people of Spain really didn't know the seriousness of the situation at the time. I think a lot of people doubted that the coronavirus existed, talk less of being concerned of how quickly it could spread. It's understandable. The virus became the topic of discussion after the holidays and when work started to pick up again. People were focused. People were busy. They thought it can't come here. It's not our problem. But the problem with such reasoning is China and Spain trade with one another. People travel back and forth to China. But again, many did not expect this much damage from such a virus. Secondly, there is a lack of medical equipment and resources, especially where the elderly live. Although this is unacceptable, if you have limited supply in the first place, the reality is everyone can't be satisfied. The government needs to address this issue. The health of their citizens should not be compromised, regardless of their ages. Healthcare and the proper resources needed to maintain such a system should be readily available. Thirdly, China sold Spain unreliable test kits. Earlier, I mentioned that the government failed to address this matter with seriousness, but when it did, what happened? It backfired right in front of them. They wanted quick results to prevent future cases, but what they were avoiding became their reality. So much to digest, but let us continue to keep the healthcare professionals in our prayers. Unfortunately, they can't care for the sick without becoming possible victims, especially in Spain, where nearly 14% of cases are medical professionals. We will see how this will play out. What are some of the things your government is doing to prevent the increase in cases? Let me know down below in the comment section. And since you're already scrolling down, hit the like button, subscribe, and hit the notification bell because on Friday, I show you how my hairdresser installed my faux locks. Adios, hombres y mujeres. Nos vemos el viernes.